there is such a truly orchestrated backlash against public health measures. And we're seeing an already underfunded profession, an understaffed profession, get attacked, and seeing departments around the country defunded.
In the instance of our county, I believe with ARPA, there's $43 million of funds. And as we're speaking with them right now, I think we're looking at about $500,000 of those funds coming to the health department.
We can barely hire anyone for the health department because they can get paid maybe $3 or $4 per hour more at the dollar store down the street.
The data system that we are required to use for the state or from the state for all infectious disease reporting is older than the iPhone.
We're seeing lawmakers take our powers away. We have had the power to control pandemics for quite some time in this country, and now we are seeing a concerted effort to take away that ability.
In our own legislative session right now, they're talking about taking more powers away from public health officials and health departments.
The attacks started to become personal. It wasn't about an issue anymore. It was me as a person.
To say we're exhausted is an understatement.
There have certainly been times when I've questioned continuing in my job. We got to the point where I didn't feel safe in my home. Things got so intense out here that it does make you wonder if you want to keep doing the work.
I think it's going to be huge for health directors and health departments to be able to tell their story after this.